Tracy Cantoja, first-year nursing student at Central Mindanao University, and today I am going to demonstrate the procedure for logrolling a client. But before that, we're going to do an assessment, which is to assess or check the medical records and perform pain assessment and the ability of the patient to assist the procedure. And for the possible nursing diagnosis, we have impaired mobility and activity intolerance. For the materials, we're going to be needing a pillow, the client MOR, and the friction reducing device. Since we're all set, let's now start the procedure. Procedure number 1 is, prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. So, good morning ma'am, I am Tracy Cantoja. I am your nurse for the day, and pwede na kung ibalik yung pangalan ma'am?
I'm Hannah Sunset.
Kano sa yung birthday ma'am? I-check na ko sa yung ha. Okay, kano sa yung birthday ma'am?
October 18, 2001.
Okay ma'am. So now, we're going to proceed to explain to the client what you're going to do and why is it necessary and how he or she can participate on the procedure. So ma'am, I'm going to perform the procedure logrolling to you ma'am. So this is to reduce any pressure in your back, especially your spine ma'am. So all you have to do ma'am later on is to cross your arms ma'am. So that's it ma'am. So by doing this, it establishes a rapport and the patient cooperation and reduces anxiety and stress for the patient. Procedure number 2 is to perform hand hygiene and observe other appropriate infection prevention procedures. So now, I'm going to apply alcohol-based hand rub. This is to prevent the spread of microorganisms while doing the procedure. And now we are going to proceed to procedure number 3, which is to provide for the client's privacy. This is for the patient's safety, security, and comfort. Since I've already closed all the windows and the door, we are now going to proceed to procedure number 4, which is to position yourself and the client appropriately before the move. You need to place the client's arms across the chest. This is to assist and ensure that the patient will be in no harm or any risk for further complications while doing the procedure. So ma'am, I need you to cross your arms po ma'am, like that. And is it okay ma'am to roll over the blanket? Okay. We're going to roll over the blanket. And now we are going to proceed to procedure number 5. You need to pull the client to the side of the bed. Use a friction-reducing device in facilitating logrolling. And first, you need to stand with another nurse on the same side of the bed. So I'm going to go to the other side. This is to assist the patient with comfort in a proper alignments and hands clip to the side. So now I'm going to the other side. And now, I am going to proceed to procedure number 6, which is to assume a broad stance with one foot forward and grasp the roll edge of the friction-reducing device. This is to easily move the client towards the nurse. So, procedure number 7, on a signal, pull the client toward both of you. So, the client will be turned properly. So, now we're going to forward our right foot. And now, we're going to bend since the bed is in lower position. And now, we are now going to proceed to procedure number 8. One nurse counts 1, 2, 3, go. Then at the same time, all staff members pull the client to the side of the bed by shifting their weight to the back foot. So this is to place the patient properly with the proper body alignment. So in the count of 3, we're going to pull this. 1, 2, 3. Okay, that's it. And now we're going to proceed to procedure number 9. One person moves to the other side of the bed and places supportive devices for the client to turn. This is to ensure the client's safety when turned. So I am going to the other side of the bed. And we are now going to proceed to procedure number 10, which is to place a pillow where it will support the client's head after the turn. This is to ensure the patient's comfort and their safety. So I'm going to put a pillow here. And for procedure number 11, you need to place 1 or 2 pillows between the client's legs to support the upper leg when the client is turned. This is to ensure the patient's comfort and to avoid any leg injuries. So I'm going to put 1 pillow. Putang ko pillow bang ha? And now we are going to proceed to procedure number 12. and position the client in a proper alignment. So you need to go to the other side of the bed, farthest from the client, and assume a stable stance. Since I am now already on the other side of the bed, this is to ensure the patient's comfort and uses energy efficiently. So I am now going to position the client. So I'm going to get this. And now I'm going to proceed to procedure number 13, which is reaching over the client, grasp the friction reducing device, and roll the client toward you. This is to basically roll the client in a comfortable position. And procedure number 14, you need to, one nurse counts 1, 2, 3, and go. Then at the same time, all nurses roll the client to a lateral position. This is to ensure that the client was rolled properly and comfortably. So in the count of 1, 2, 3, go! For procedure number 15, the second nurse or behind the client helps turn the client and provides pillow supports to ensure good alignment in a lateral position. This is to ensure that the client's comfort in lateral position is prioritized. So now, we're taking this, and we are now going to put a pillow. And now, for procedure number 16, support the client's head, back, and upper and lower extremities with pillows. This is to ensure that the client's comfort and reduces the risk of any further injury. So now, I'm going to put this here, and here. And now, for procedure number 17, you need to raise the side rails and place the call bell within the client's reach. This is the patient can easily call the nurse in times of need and support. So now I'm going to put this here. And now we need to proceed to procedure number 18 is to document all relevant information while doing the procedure. This is to be used by other healthcare workers for the better condition of the patients. And before that, we're going to apply alcohol-based hand rub for the procedure. This is to prevent the spread of microorganisms. Thank you. Now we're going to record the data. And since we've already recorded the data, that's it for today. Thank you for being with me, and thank you.